So good morning to everybody. I am Dr. Shilpa, glaucoma specialist practicing in Bangalore. I am the director and glaucoma and cataract consultant at Asta and Vardhaman Super Speciality Eye Hospitals here in Bangalore. On this occasion of World Glaucoma Week, it becomes my prime duty and responsibility to uh, spread the awareness of glaucoma and why glaucoma is commonly called as sneak thief of sight, or why we call it as it just robs away our vision without our knowledge. So glaucoma is a group of eye diseases which usually manifests in elderly age group with high eye pressure and resulting in permanent field damage, and thereby affecting the quality of life. So now coming to usually the questions that come up when we talk about glaucoma is how and why does it occur? How and why does it occur is a very elaborate thing to be known. The glaucoma usually is because of the pressures, as we all know, intraocular pressure. Eye is beautifully designed like a camera which captures the images. It is processed, the signals are processed through the optic nerve to the brain. So the central processing center is the brain. So the optic nerve, which is a connecting thing between the eyeball and the brain, is at risk when the eye pressures go up. So what happens is usually there are the constant secretion and drainage in the eye is a dynamic phenomena which happens from birth to the death. So usually it is because of the blockage in the drainage with age that results in high eye pressure, because the secretion of the fluid inside the eye, what we call is aqueous humor, it remains constant. So this is the cause of the damage. So once we know why it occurs, then we should know how do we prevent it and what are the risk factors that will lead on to glaucoma. So the most common risk factor that we see is because of the age itself, and diabetic hypertension, which are very common in Asian countries and growing at a rapid rate. Those are at risk factors, considered important risk factors. The other eye specific related risk factors are extremes of refractive errors like high myopia, high hypometropia, any eye injury, eye trauma, or any steroid usage for any other medical problem can cause high eye pressures. So once we know that the pressures tend to go up, then the most important thing is what symptoms it causes, or how do we know that our pressures are going up. That the basic key lies here, because once the pressures goes up, usually we don't have any symptom. It is totally symptomless. So something like your blood pressure, which fluctuates and you're not aware of it. So the eye pressure is also in analogous to blood pressure, which you don't sense it. Very rarely, the pressures can present very high levels. That time the patient can have headache, eye pain, sometimes can have nausea, vomiting. So those things, when the patient can land up with physician rather than an ophthalmologist, because don't attribute it to the eye problem. So you have to keep in mind that these kind of rare symptoms can be there. But otherwise, sometimes just the frequent change of glasses after 40 years itself can be an indication for glaucoma. And if you have a family history of glaucoma, all the more you have to keep watchful of these subtle symptoms, which I was telling you, so that you can approach your ophthalmologist or a glaucoma specialist early so that it is detected early. The basic dictum for glaucoma management is how early it is detected. If you detect it early, then there ends the like most of the suffering, because once it is detected, we can control it almost throughout your lifetime, and your vision and the field of vision will be safeguarded. But if you neglect it, then it results in irreversible damage. So we can call it as needless irreversible damage that can happen when we know so much about glaucoma, which already has been, last 2 decades, there are a lot of advancements with respect to treatment and even the investigations that we carry out for glaucoma. So don't miss this chance to get yourself screened for glaucoma, especially people who have all these risk factors that I mentioned. So now, how do we investigate, or how do we come to a conclusion that yes, you are a patient of glaucoma, or you need to be under treatment? So we have pressure recording instruments, different pressure recording instruments, but pressure alone cannot be just glaucoma, or any high pressure is not equal to glaucoma. We have to have documented field changes, documented optic nerve changes, or the what we call using photography, fundus photography, or OCT scans that will say that the changes are evident, which can be related to high pressures. So all this is a jigsaw puzzle which we put in together to form a complete picture of glaucoma. So that's why some people might feel that when they just come across and we tell them your pressures are high without any damage and you need to undergo these investigations, don't ignore it, because these investigations will tell us even if the field damage has not occurred, we can detect glaucoma at that stage also, so that it can be prevented from total occurrence of the field damage. So all these are the investigations that we can do, and has to be done periodically for re-evaluation, and to see that it remains the same over a period of time. It is just not one-time investigation that you are done with it. No, periodically it has to be repeated, and then your eye pressure, target pressure has to be reset, that the ophthalmologist will take care of doing it, and periodic evaluation is a must, so that the glaucoma is totally under control. So next, how do we treat it? The most common modality, or easily accessible, or easily patient can avail it at their convenience, is the medical therapy. So we have simple drops which they have to instill. Most of the times it is just once or twice a day, so as advised by your doctor. So once the pressures come down and the medication is suitable for your eye, so we can just continue with the same medicines thereafter. But in case if the pressure medications are ineffective, or so there are some contraindications or adverse events for the medications, then we have to change the medicine, or go in for other modalities of treatment like lasers and surgeries. Laser therapy, there are specific conditions or specific situations wherein lasers will help, especially in angle closure glaucomas, and in cases of advanced glaucomas, where there is like we don't have an option of doing a surgery, or the patient is just wanting to get rid of the pressures. So that time the lasers definitely have a role in the management, being non-invasive and a relatively simple procedure compared to the surgery itself. Then after laser comes the surgery, when the medications are ineffective, when there is a coexistent advanced damage, and we have to bring down the pressure. So there are a lot of myths regarding surgery for glaucoma, because it is just not like you undergo surgery and you're cured for glaucoma. No, that is the biggest myth the people have. So it is just a measure to reduce your pressure, like any other measure, any other treatment measures I was talking of. So once the pressures are reduced, still it has to be monitored over a period of time, that because no treatment can assure you for lifetime control. So they have some restrictions, or luckily the surgery part takes upper hand, because it reduces pressures to really, expected low levels, and then the fluctuations are taken care of, and patient is off medications, and the eye medications itself can cause some amount of dryness and redness and all those things. So these adverse events are totally negated with surgery. So but the surgery, on the other hand, we have some certain complications, yeah, as every surgery has, but then they can be very well managed, and believe me, your pressures can get under control with all the available measures that we have at hand. So with this brief introduction and the knowledge about glaucoma that I have shared, I wish everybody just get screened for glaucoma after 40 every year, or as advised by your ophthalmologist. And just make your sight is in your hands. You have to just be careful and have this glaucoma under control. If you have it or if you don't have it, don't lose your eyes for this glaucoma to see this bright life. Thank you so much.